So what that group did is it took the national risk assessment and then with Welsh Government and with representatives from the 4 local resilience fora, considered how that risk assessment applied within Wales and the steps and actions that should be taken, including the inclusion of the risks in local resilience fora, community risk registers.
And did that also involve an assessment of any gaps in preparedness that might exist at the local level?
We also, as I've already said, had representation at the local level, and our representation at the local level included liaising with each of the local resilience fora about their assessed risks and advising them accordingly.
And so how did Public Health Wales have the necessary arrangements in place to effectively support and enable the local resilience fora to make their own rapid and effective responses to the pandemic when it struck?
So Public Health Wales's health protection team, together with the microbiology service, used our emergency response plan as the basis for our initial response to the pandemic in 2020. And in doing so, we were aware that the local resilience fora, in turn, were standing up their strategic coordinating groups as is appropriate as a response.
What is the Wales Resilience Forum and how does Public Health Wales contribute to that?
Wales Resilience Forum is a structure within Welsh Government that is chaired by the First Minister and includes representation from all multi-agency partners at a strategic level to consider the risks across the piece, so not confined only to health. And I represented Public Health Wales as a member of that group.
How does that sit with the Wales Resilience Partnership team?
The Wales Resilience Partnership team was a group underneath the Wales Resilience Fora, in part providing secretariat functions and in part tasked with the operationalisation of some of the activities that had been discussed at the Wales Resilience Forum.
Did you also sit on the Wales Resilience Partnership team?
I didn't, but our emergency planning and business continuity manager did.
Right, thank you. All right, now having established the body that Public Health Wales became in 2009 and its functions and responsibilities, I'd like to now look at some of the plans that were in place over the course of the Module 1 time period. And first of all, please, can we look at 89558, which is the Public Health Wales Emergency Response Plan. We can see that this version is version 2, created in September of 2018. And if we go to page 2, please, we can see that under the heading Sponsoring Executive, you appear as the sponsoring executive. What does that mean in terms of this particular document?
What that means is that as the executive lead for public health emergency planning in Wales, this document was endorsed by me and commended by myself to our board for consideration.
And what was the purpose of this document? How was it intended to be used?
So this document, as it says at the top, provides the specific arrangements for our strategic and tactical response to emergencies, incidents and outbreaks. And it's the top-level document of a suite of documents also that sit with this. It is an internal document, but it has been written very much in the spirit of the Civil Contingencies Act, was shared with and therefore deliberately made known and to our local resilience fora partners.
So they had access to this?
They and Welsh Government had access to this document.
Thank you. Can we go to page 9, please, and look at paragraph 1.1. Thank you. We can see here, under the heading Introduction, that Public Health Wales Emergency Response Plan details the organisation's response arrangements to any emergency incident or outbreak that impacts on or requires the mobilisation of public health resources and capabilities. The Emergency Response Plan provides a framework to establish, create and improve resilience. Did this document replace an earlier iteration, and if so, when was that first created, please?
So this document replaced an earlier version which had been approved by our board in November 2016. And indeed, it was about the fifth. I'd have to just remind myself we had a plan in 2009, 2012, 2014, 2016, and yes, this would have been the fifth iteration of the plan in 2018.
It wasn't updated, was it, until 2022, I think?
That's simply because events overtook us at the beginning of 2020, which is, I mean, we review our plans annually anyway. The plan was still we considered relevant at the beginning of the outbreak of the pandemic, but we, during the course of the pandemic, recognised that the plan would need updating, and at the earliest appropriate time, we did so.
Thank you. Can we go to page 10, please, and have a look at the roles and responsibilities? We can see that third row from the bottom. Can we just scroll out, please? Here we are. Facilitate epidemiological follow-up of affected populations and communities as necessary. To what extent did Public Health Wales achieve this? What was this intended to represent?
So, in an incident, an emergency, particularly in an outbreak, what we always sought to do was to assess the impact of that on the populations affected. We did this during the COVID response. A wide range of assessments were undertaken, including epidemiological assessment. But an example would be, had there been a chemical release from a factory with a cloud of gas discharged and floating over a local population, we would follow, after that event had been resolved, we might well follow up with the affected population to see if there had been any longer-term impact.
Do you agree that within this document, the EPRR information largely focuses on command and control measures and doesn't include any specific detail on how to handle a coronavirus outbreak, and it doesn't go into any plan for non-pharmaceutical interventions?
So I think I should explain that this plan, which is an all-hazards plan, it's a generic plan, was written in the context of Public Health Wales as a Category 1 responder, being able to demonstrate that it was fulfilling the requirements of the Civil Contingencies Act and the duties and responsibilities, including statutory and non-statutory guidance. And that is how this document has been written.
So is your answer that you wouldn't have expected that level of detail to be involved or incorporated into a document such as this?
I would expect that information to be in other documents.
Right. Well, we'll move to look at other documents in a moment. But before we do, we can take that down, please. I'd like to ask you about the Health Protection Advisory Group. That is a group that had been, or indeed has been, in existence for many years, hasn't it?
It has, yes.
And it was, it involved the CMO, the Chief Medical Officer for Wales. But you tell us in your witness statement that there was a period of abeyance of the group before it was re-established in May of 2018. why was the group put into abeyance, which required it to be re-established in May of 2018?
So the group is a non-statutory advisory group to the Chief Medical Officer. And in 2014, the then Chief Medical Officer retired, and the group therefore ceased to meet. The current Chief Medical Officer came into post later in the year, and then at the beginning of 2018, he decided that he would like to re-establish the group.
What was the involvement of Public Health Wales in that group?
Public Health Wales has always been a member of the Health Protection Advisory Group.
And to what extent was pandemic preparedness discussed during those group meetings?
So the group looked at the whole breadth of public health threats and hazards, and Public Health Wales advised and supported the group, for example, by preparing technical documents and papers for it to consider. And influenza pandemic preparedness had been one of the subjects of discussion in the group.
And what was discussed about it?
So we had been aware that in 2016 or 2014, as has been discussed already, there had been an exercise in Wales, and that there had also been an exercise at the UK level that Wales had participated in, and that had generated recommendations and outputs which needed to be followed through.
And so did Public Health Wales become involved with the recommendations that fell out of Exercise Cygnus and the other exercises that ran before that, which we'll turn to look at in a moment?
So when Exercise Cygnus took place, Public Health Wales had two representatives observing. When the report was published in July of 2017, we obviously received a copy of that report, and as was shown yesterday, a Wales Influenza Pandemic Preparedness Group was convened, meeting first in September that year, and Public Health Wales was represented on that group.
All right, well, we'll come to look at that in a moment. But before we do, let's just have a look at a set of meetings from this group from the 17th of December of 2019, when the Health Protection Advisory Group met, and we can see from the first page that Public Health Wales were represented by Andrew Jones. You sent your apologies for that meeting. We can see that halfway down the page, but no doubt you will have been filled in by what took place during the course of the meeting and any recommendations that came out of it.
Yes, I was on annual leave. Andrew Jones is my deputy.
Thank you. Can we go to page 4, please, of these meeting notes and look at paragraph 5.2? Thank you. We can see that the CMO acknowledged that there were significant questions around the preparedness of NHS Wales to deal with a similar situation and to be able to manage an infected case at one of our acute hospitals for at least 24 hours. It was agreed that whilst a key work stream of strengthening the National Health Protection Service would look at an all-Wales system for dealing with high-consequence infections, more urgent action was necessary to provide reassurance. To what does this relate, please?
So this relates to discussions that were taking place at the time about the development of a high-consequence infectious diseases unit in Wales.
Yes.
At that time, it was necessary for any patient that had a high-consequence infectious disease to be transferred to a designated unit in England.
Yes. Right. Well, if we look at the bottom of this paragraph, we can see that Action 23 was for the CMO to write to health boards and Public Health Wales and WAST requesting their plan or pathway for dealing with a high consequence infectious disease, the deadline for which was March 2020. Do you know whether or not that was done?
So in January 2020, as it became clear to us in Public Health Wales that the novel coronavirus represented a very serious threat, we as an organisation entered into discussions with Welsh Government and with one of our local health boards to discuss how we could establish very quickly a high consequence infectious disease unit at that hospital in advance of and readiness for potential patients if novel coronavirus came to Wales.
All right. We can take that down, please. I'd like to now look at the Emergency Planning and Business Continuity Group and to look at the terms of reference for this group, which are at 89648. Thank you. We can see that's the front page there. These are the terms of reference. If we turn to page 2, please, we can see in the top third of the page that, again, you are the sponsoring executive as the Executive Director of Public Health Services and Medical Director. Can you tell us when this group was established and what the purpose was for the group being brought into force?
So the group was established in August 2018. The story behind it is we had conducted a review of our business continuity arrangements in 2016, and that review had recommended that we should bring together our business continuity and emergency planning arrangements under the leadership of a single executive. They were at that time under different executives within Public Health Wales. It also recommended that we should establish the role of the business continuity, the emergency planning and business continuity lead, the manager that I have already referred to.
Yes.
So all of that was accepted in 2017. And in 2017, we started to bring these all entities together, and that was finally completed and formalised in the first half of 2018.
If we look at the bottom part of this page, we can see that under the heading Updates and Amendments that there is a blank table. Has this document, these terms of reference, ever been updated or amended?
I don't know the answer to that question to the current time.
All right. Well, if we need to establish the answer for that, then we will formally ask. But is it right that the Emergency Planning and Business Continuity team was steered by the local resilience forum?
The Emergency Planning and Business Continuity team effectively provided the operational leadership for the implementation of the emergency preparedness, planning and response arrangements of Public Health Wales. And that necessitated engagement with a wide range of partners, Welsh Government, local government, the health boards, the local resilience fora.
Well, let's look at the Emergency Planning and Business Continuity Work Plan, please, 2018 to 2020, which we can see at 183523. Was this document the work plan for the group?
It was.
And you sponsored this document as well, didn't you?
I did.
Which was approved in July of 2019. Could we look at page 2, please? Thank you. We can see at the top that the document outlines the emergency planning and business continuity actions for the time period. The actions address the legal requirements on Public Health Wales in its role as a Category 1 responder. And can we go to page 9, please? We can see that this sets out the emergency planning activity under the Integrated Emergency Management System. And if we could just scroll through the next few pages, we can see that there are the 6 phases that we've seen before. Thank you, if we can carry on. Ending with, next page please, response and recovery. There are no references to pandemic or influenza in this document, although there are references to bomb threats and Brexit health and other such matters. Do you agree with that?
I do agree with that.
Why were references to the threats of or hazards of pandemic influenza and matters of that nature not contained within this document?
So the reason why Brexit was included, because it was a live issue at the time. Pandemic influenza was not included because we were having those were set out in the other documents that no doubt we will come to the documents that have already been referred to, and that this therefore took a strategic approach to how we discharged our responsibilities under the Civil Contingencies Act in respect of any incident, outbreak or emergency that might take place. But it didn't explicitly refer to the development of pandemic influenza planning.
Were you aware when you sponsored this document that the National Risk Assessment had assessed the hazard of pandemic influenza as being at the first tier? So it created the most serious threat.
Yes, we did.
And so do you still say that it wasn't necessary or appropriate for it to be mentioned in this work plan for emergency planning?
As I say, we recognised that pandemic influenza was at the top of the National Risk Assessment, and we were fully engaged throughout the period of Module 1 in direct discussions with Welsh Government and with our local resilience fora to prepare and respond to influenza pandemic.
But that's not really an answer to the question. Didn't it deserve a mention in this document?
In hindsight, yes, I can see that it could, but at the time, having just established this group, we didn't include it.
Does the fact that it's not included demonstrate that pandemic influenza was not in the forefront of the mind of Public Health Wales and other organisations who were involved in the creation of this document?
No, I don't agree with that. As I prefaced my previous answer, Public Health Wales has had a full and active involvement in support of and advising Welsh Government and partners in the development of our pandemic influenza plans.
Public Health Wales did sit on the Wales Pandemic Flu Preparedness Group, didn't it?
It did.
And I'd like to look now, please, at a set of minutes from the meeting of that group in January of 2018. We have them at 187219. Thank you. Now we can see who was present. Dave Goulding, who is the Welsh Government Health Emergency Planning Advisor, and other members of the Welsh Government. And then we know that Public Health Wales was present, although the name of the person attending has been redacted. So that wasn't you on this occasion?
No, it wasn't. but I do know who it was.
All right. Well, perhaps that doesn't matter, and if it does, we'll come back to it. Could we have a look, please, at the second paragraph, which is, I think, on page 2. Thank you. Here we see, under the heading UK Pandemic Flu Review and Work Plan, DG discussed the PFRB high-level work plan, advising that the review board had agreed to extend the time period into a second year to address ongoing deliverables. He asked if there were any questions regarding the work plan. None were asked, and added that the next UK Pandemic Flu Readiness Board would meet at the end of February. WP alluded to the difficult timescales for some areas being set centrally. The meeting then discussed the importance of operational delivery. Through the UK review, some pandemic influenza strategic policies and guidance are updated, notably the UK Pandemic Influenza Framework 2011 and the Cabinet Office Pandemic Influenza Guidance to the LRFs. Now, is it right that 3 of the 4 LRFs were not in attendance at this meeting?
You'd have to re-show the first page for me to be certain.
Well, can we go back to that, please? At the bottom paragraph here, we can see it was noted with disappointment that 3 of the 4 LRF chairs were not in attendance. WP confirmed that the LRF chairs had been invited and that no apologies had been received from them. Reference was made to LRF engagement being taken forward by the DCLG in England and the need for Welsh Government to also engage with the LRFs in Wales. DG emphasised the importance of having the LRF chairs on the group and asked that this be reinforced with them. Does this chime with any concern that you had about the engagement of LRFs in this particular group?
Until I saw these minutes recently, I had not remembered that only 1 of the 4 LRFs had been in attendance. My memory of our LRFs is that they were active and full participants in pandemic flu preparedness, and I've noted which health board was in attendance. I share this disappointment of the chair and fully agree with his sentiment that they should be reminded of the importance of attending.
Was this a common theme? Was this a problem that the LRFs were not engaged in this particular group?
No, as I said at the preface to the last answer, my experience was that the LRFs were active participants with us in all areas of emergency planning and response, including pandemic flu.
Is your recollection at the time that these meetings were taking place, and these minutes, I remind us, were at January of 2018, that the Wales Pandemic Flu Preparedness Group was an effective group?
So I was aware that there were a range of work streams which had made limited progress, as has been discussed already.
All right. Well, I'd like to look, please, again at page 2 and at paragraph 3. And the first paragraph there. WP advised that it was the perception at a UK level that Wales and other devolved governments were lagging slightly behind England in some areas, such as legislation and health and social care surge planning, due to a lack of resource. Were you aware of that at this time?
I was, and I recognise those issues.
All right. And what was done about it?
So, as I understand it, Welsh Government were undertaking work on health care surge planning, particularly in the area of critical care. I wasn't familiar with the detail of the progress with the social care surge planning.
Right. We can take that down, please. The Wales Health and Social Care Influenza Pandemic Preparedness and Response Guidance we see at 89573. Could we put that up, please? Now, this was issued, as we see, by the Welsh Government Department of Health and Social Services Health Emergency Preparedness Unit in February of 2014. And this was really the Welsh response to the United Kingdom 2011 guidance, wasn't it?
It was.
Yes. You will be familiar with this document, Dr. Sandifer?
Yes.
Yes. And you can confirm then, without us having to go into the detail of it, that in general terms it relied upon the planning assumptions that had been established in the UK 2011 document?
Yes.
All right. This guidance deals with stockpiles of a range of consumable products, including eyewear, aprons, gowns and gloves. We don't see that level of detail in the UK document. Did Public Health Wales have any involvement in providing the additional guidance in relation to those particular areas of stockpile?
So the Welsh Government led on countermeasures stockpiling, including PPE. Our infection prevention control lead did occasionally provide advice to Welsh Government if any specific questions were raised, but we had no other direct involvement.
Could we go to page 13 of this document, please? Thank you. Now, we can see here the coordination arrangements for major infectious disease emergencies in Wales. If we familiarise ourselves with this, we've got the National Security Council at the top, SAGE to the right. Then going from left to right on the second level, the Department of Health organisations and the devolved administration health departments. In the middle, we've got the Wales Civil Contingency Committee and the DH&SS Health Response Team, and to the right, the Strategic Coordination Groups. And then on the third tier, left to right, we have the health boards, the NHS trusts, and there in the right-hand corner at the bottom, Public Health Wales. Now, is that coordination arrangement familiar to you?
It is.
There would appear from this chart to be no direct contact or line of contact between Public Health Wales and, for instance, the SAGE group that we see at the top right-hand corner. Do you think there should have been?
So, as I said earlier, no, there was no direct connection between us and SAGE. We expected that Welsh Government would be invited to join SAGE at both ministerial and official level. And if it was thought appropriate by Welsh Government for Public Health Wales representation in support of their minister or officials, then we would have been pleased to provide that.
All right. Can we go to page 31, please? Now, in relation to community care, we can see that the guidance here is that as demand for hospital care increases, patients discharged home may require a greater level of care than they would do normally. Social and community care services may face particular challenges that include, and there are a series of bullet points there. Just moving down below the bullet points, care of individuals in the community therefore presents a diverse and complex challenge at a time when staffing increases are likely to be reduced. Close working relationships across health and social care organisations, the independent sector and voluntary groups will be essential to sustaining services during a pandemic. Do you agree, Dr. Sandifer, that this plan should have included more guidance around when someone should be discharged from hospital and what should happen on discharge back into the community. For example, guidance on sending tested or untested patients to care homes or back into the community.
Obviously, that became an important issue during the coronavirus pandemic. And I can see that that could have been helpful to the health boards. And incidentally, it was the health boards and the local government overseeing social care services that would have been the principal beneficiaries of that guidance.
Do you agree that there is also a failure or a gap in this guidance to include advice in terms of when lockdowns or social distancing measures of any description could or should have been implemented?
Well, on lockdowns, I think it's fair to say from my own professional experience, I hadn't envisaged circumstances where we would have locked down a whole society or indeed a whole country in the way that we did in March 2020. Of course, self-isolation of individuals or perhaps a family unit or quarantine of a small defined population are established principles in public health infectious disease control, but lockdowns took us into completely uncharted territory.
But there's nothing in this document about any social distancing measures of any severity from mixing with people within your community and that being restricted to the other end of the spectrum, which is lockdown. Is that a mistake?
I would expect our health boards working through their local resilience fora to be familiar with the basic tenets of social distancing as a regular or a normal practice in reducing community transmission. So at the, if you like, that end of the spectrum, I'm not sure that that needed formal guidance. But of course, lockdowns, I don't think were anticipated in the way that they were implemented, and that is the reason why they don't appear.
All right. Well, before we turn away from plans and guidance, I'd just like to look at two more documents, please. The first is at 89572, and this is the Welsh Government's Wales Framework for Managing Major Infectious Disease Emergencies. I know that the inquiry has already looked at this document. It's dated October of 2014. We can see at the bottom left-hand corner it's issued by the Health Resilience Branch of Welsh Government. I'd just like to look at paragraph 1.1 on page 5, please. And 1.2 as well. If we could zoom in, please, on those two paragraphs. We know that this framework sets out generic arrangements for the management of major infectious disease emergencies by health services in Wales and should be considered in the context of the principles set out in. Then there's four more pieces of documentation and guidance. The NHS Wales Emergency Planning Guidance, the Cabinet Office Statutory Guidance on Emergency Preparedness, and the non-statutory guidance of emergency response and recovery, and the Pan-Wales Response Plan. And the framework is supported by the following guidance, and we've then got 5 more pieces of guidance. The Communicable Disease Outbreak Plan for Wales, the United Kingdom National Framework for the responding to an influenza pandemic, which we've already mentioned, guidelines for smallpox response, Wales Health and Social Care Influenza Pandemic Preparedness Guidance, which we've just looked at, and the NHS Wales Guidance Mass Casualties Incidents, a framework for planning. This was a complicated business, wasn't it?
It was.
Did you, in your role at the time, find it unhelpful that there were so many different pieces of guidance and planning documentation that would need to be assessed and considered in the outbreak of a pandemic?
I was very conscious that you had to have a good understanding of the range of organisations and guidance to be able to navigate your way through this.
Right. Far better, do you agree, Dr. Sandifer, to have a slimmed down, a simplified set of guidance and plans for everybody to be able to understand and follow?
There's absolutely no doubt that the principle of consolidating and simplification is a good idea, would have been helpful, but I think it's just worth recognising the context of a couple of these plans. The Communicable Disease Outbreak Plan for Wales, which we haven't discussed yet, that was really a plan for responding to local outbreaks, whilst this framework was for responding to infectious disease threats that might affect the whole of Wales. So I think it's important to recognise that there was some need for distinguishing between a plan to deal with something at a local level, between something at a national level, but the general premise of simplification would have been helpful.
Thank you. Well, let's look, please, finally, at the Communicable Disease Outbreak Plan for Wales, which is at 89575. Thank you. Can we go to page 2, please? Now, we can see under the preface, written in April of 2014, in recent years, there have been multiple plans in Wales for the investigation and control of communicable disease. All these have contained very similar guidance. Whilst it has been recognised that each individual plan was robust and fit for purpose, the presence of several plans for use in outbreaks has caused confusion as to which plan should be followed. Therefore, at the request of the Welsh Government, a multi-agency working group was convened in 2008 to draw the plans together in one generic template. So just pausing there, this is a reaction in April of 2014 to multiple plans for the investigation and control of communicable diseases. So this was an effort undertaken in 2008 to simplify things. But as we've just seen, in fact, although this one response deals with this particular area, when you look more widely, there were still multiple pieces of guidance and planning documentation that was still in existence.
That's correct.
Can we move down, please, to look at the full page? Thank you. And if we can go over to page... Oh, in fact, before we do that, can we just highlight what we can see in bold in the middle of the page, please? Because when we look at what was used to create this plan, we can see that it's an amalgamation of a major outbreak of food poisoning plan, an emergency framework for health-related incidents and outbreaks in Wales and Hertfordshire from contaminated drinking water, and then finally the model plan for the management of communicable disease outbreaks in Wales. So far as this inquiry is concerned, that is the model plan upon which this document was able to draw.
Yeah, if I could just clarify something about the development of this plan. We had a series of plans highlighted in bold here in the early noughties, which we recognised caused confusion, as the first paragraph states. The work began in 2008. The first version of the Wales Communicable Disease Outbreak Plan was actually published in 2011. And then we kept it under review, and this plan reflected an updating of the 2011 Communicable Disease Outbreak Plan in April 2014.
All right. Well, I want to look further back, please, because the management of communicable disease outbreak plan, upon which this was based, taking into account what you've just said about there being an interim plan in 2011, was first written in 1995. Is that right?
As I understand it, yes.
And not updated until this plan was brought into force, although we can see that there was a draft update in 2007.
So there was a draft update in 2007, and then that plan, together with the other two plans, consolidated into the 2011 plan that I've just referred
Yes.
to.
Why was the management of communicable disease outbreaks plan not updated between 1995 and 2011?
I don't know the answer to that. I predated my time in office.
Do you think that by 2011, the 1995 plan was massively out of date?
Well, the 1995 plan had been updated, but it was in a draft form.
Well, according to, I'm so sorry, Dr. Sandiford, but according to this note, although a draft update was in force in 2007, from what you've told us, that wasn't formalised until 2011.
That's right.
All right.
But I would anticipate that our communicable disease specialists would have been working to the most updated plan, even if it was still in draft format.
But why wasn't it updated between 1995 and the draft update of 2007?
I don't know the answer to that question.
Does that concern you?
It is a very long time, and I would have expected our plans to have been reviewed and updated in a period of 12 years, at least once or twice.
Yes. So does it concern you that it wasn't, according to this note?
Yes, I mean, it's a concern that 12 years elapsed between updating of a plan.
Again, I have to ask, does the fact that the communicable diseases outbreaks plan was in abeyance, I'm going to suggest, demonstrate that this was not a subject at the forefront of those who should have been thinking and planning about it?
I don't think that's a fair characterisation of the people who were responsible for discharging communicable disease control during that period. It is a fact, and I'm not disputing that for a period of 12 years, it would appear that this plan was not updated, and I don't have information to explain that.
All right. Well, I'd like to go back, please, just for a moment to the emergency response plan that we've looked at briefly, the Public Health Wales Emergency Response Plan, which is at 89558. Because I'd just like to, for a moment, concentrate on what level of consideration was given by Public Health Wales in this emergency response plan to vulnerable people. And we can see that consideration at page 25. Public Health Wales is required to give special consideration to those who are made vulnerable as a result of the emergency or who are less able to help themselves in the circumstances of an emergency. And we see at 14.5, those who are vulnerable will vary depending on the nature of the emergency. For planning purposes, the Cabinet Office guidance states that there are broadly 3 categories that need to be considered. And then we have those with mobility problems, those with mental health or learning difficulties, and dependents such as children. So it rather looks as if Public Health Wales were taking their lead as to who would qualify to be described as vulnerable from the Cabinet Office guidance at Chapter 5 of the Emergency Planning Revision to Emergency Preparedness document.
Yes, I would accept that.
Do you think that that was an extensive enough description of who should be categorised and considered as vulnerable?
Well, in hindsight and reflecting from today, no, I don't.
Because it doesn't contain any mention of the elderly or those with comorbidities or those suffering from health inequalities, does it?
No, it doesn't explicitly refer to those, but the way I would expect this section of the plan to be implemented is that in the circumstances of an emergency, a risk assessment would be undertaken. The populations most at risk in the course of that incident would be identified, and the responders would pay due attention to those. And that could be a very, very long list, but this does reflect what the Chapter 5 says in the guidance.
Has that narrow definition now been expanded?
So Public Health Wales recognises that it needs to take a more, to quote Alexander and Mann, people-centred approach to its emergency response planning, and the current guidance plan that was recently published takes us some way toward that, but acknowledges that there is still further work to be done to address that issue.
Is that plan that you've just mentioned, the updated plan, an update of this?
It is.
And what's the date of it, please?
May of 2023.
So the current position is that, as you've just told us, Dr. Sandifer, the definition has been broadened, but on reflection now, it needs to be broadened even further.
So it has been broadened, and in very particular way to take account of inequalities, recognising the particular impact inequalities had during the coronavirus pandemic. But it's my view that plan represents a stage in a process that still needs further development, and I understand that my successor has had conversations with his strategic partners to signal the need for us to continue that work.
Do you know when that will be completed?
I don't know when that work will be completed. The plan has just been approved, and I would envisage that Public Health Wales will attend to that now.
And are you able to help us with the detail of how that current definition still requires to be extended?
Well, this definition is still within the guidance. These groups are still relevant categories.
Yes.
In any future plan. I would envisage that the plan as it develops might move away from the expression of vulnerable persons, although that is generally recognised within the EPRR community, and set out more broadly the wider range of vulnerabilities in the population that the plan should consider.
So I'm going to press you on this. What isn't contained in the current 2023 guidance that needs to be contained within it?
Well, the guidance does refer to inequalities, but I think it could go further and expand on what that means in terms of different population groups, minority ethnic groups, for example, who were particularly vulnerable during the coronavirus pandemic.
And for whatever reason, that level of detail has not yet found its way into the 2023 guidance.
And that, I think, is simply a reflection of the scale of work that Public Health Wales is still engaged in the transition of Covid-19 into an endemic and the recovery work associated with that.
All right. Thank you very much. Those are all my questions for Dr. Sandifer. I understand, my lady, that you've provisionally provided permission for Bereaved Families for Justice Cymru to have 5 minutes of questions on particular topics. May that be done, please? Thank you.
Thank you, my lady. Dr. Sandifer, my name is Laura Shepherd, and I ask questions on behalf of Covid-19 Bereaved Families for Justice Cymru. I want to look at an exhibit in your witness statement. If we could have up on the screen, please, 89594. So this is the report to inform policy on airborne isolation rooms in major acute hospitals, and it's the report of the Airborne Isolation Rooms Review Working Group on behalf of the Welsh Government. If we have a look at the date, it's the 18th of October 2017, and we can see the purpose and summary of the document at the bottom. If we look now, please, at page 2. In the introduction, and it's the top paragraph, it says here, since 2006, NHS Wales Shared Services Partnership Specialist Estates Services have surveyed and produced an annual report on all airborne isolation rooms in major hospitals across Wales. Every year, the reports have concluded that many of these airborne isolation rooms are inadequate for the purpose intended when assessed against current best practice. And then the rest of that introduction just outlines why there needs to be a working group to look at this. If we then look, please, at page 3. If we have a look at page 3 next. These are the recommendations, and this is an indicative list of the organisms requiring airborne isolation facilities. Subparagraph F, SARS-like infection and MERS-CoV. If we have a little look down at the bottom of the page, there are some recommendations. Recommendation 2, every hospital in Wales with a 24-hour emergency unit must have at least one negative pressure suite located within that emergency unit. And then the recommendation below, every health board in Wales must have at least one negative pressure suite able to accommodate a case requiring respiratory isolation. If we have a look now, please, at page 13 of this document.
Ms Shepherd, just before you go on, can you alert me to which is the question I've given permission for you to ask?
Yes, my lady. You gave me permission to ask why there hadn't been an update to the airborne isolation facilities in accordance with this document.
Sorry, I must have lost it. Anyway, okay.
If we have a look at page 13, the very bottom bullet point of this page, it says current building structures do not support safe management of patients with infectious diseases, pose significant risks to the capacity of the hospitals following admission, even of suspected cases, pose a threat to the well-being of healthcare staff. So that was the case as at 2017. Ms Blackwell Casey put to you earlier some meeting minutes from 2019 when the CMO, Sir Frank Atherton, had raised the issue with ability to deal with HCID infection. Was that still the case as of January 2020?
Yes, I expect it was. I certainly raised it as a concern, an ongoing concern, in July of 2019 with the Chief Medical Officer. I fully recognise this report and I fully agree with the content of this report. And I should state here for clarity, the responsibility for ensuring that there are safe isolation facilities on the healthcare estate rests with the health boards in Wales.
If we have a look finally, please, in this document at page 14 and the very top bullet point, none of the health boards are designed to deal with such threats, and there is no hospital in Wales currently that has a facility to manage emerging infectious threats at an optimal level. So, since 2006 this has been raised. It was raised in this document in 2017, and it was raised again by the CMO, Frank Atherton, in 2019. We get to January 2020 and still nothing has been done to address this. Do you agree?
I agree that this was a significant area that, yes, had not yet been adequately dealt with over a very long period of time.
Does that reflect that there was a lack of urgency in Wales to address this issue and lessons were not learned?
I can't speculate on the precise reasons for that. As I say, Public Health Wales has flagged this as an issue over the years, but the issue clearly was not fully addressed by the time COVID-19 came along.
Does that reflect a lack of urgency to deal with infection control generally in hospitals?
Again, our health boards who have responsibility for the hospitals in Wales also have a responsibility for healthcare associated infections and antimicrobial resistance. And again, that was a journey that they were still on. Public Health Wales had worked with them over the years to address the performance, and generally progress had been made. Some had made better progress, but we were not yet where I would have liked by the time we reached the end of 2019.
Thank you, my lady.
Thank you, Ms Shepherd. I did find the question in the end. Thank you. Ms Blackwell.
Thank you. That concludes Dr. Sandifer's evidence.
Thank you very much for your help.
Thank you.
I think the suggestion is I should take a shortened lunch break because we've got quite a heavy afternoon.
Yes, my lady. Would you consider perhaps sitting again at 1:45?
Very well.
Thank you very much.
1:45, please.
All rise.